The following segment on Eyewitness News is sponsored by Living Well.
And welcome to today's edition of Ask the Expert. I'm Shay Paul, and I am being joined by my friend, Dr. Jared Chapman of Living Well, who I might add looks awfully refreshed and tan today.
Well, maybe a little vacation last week.
Well, it well deserved, I'm sure. So, Dr. Chapman, we've talked a lot in the past about Botox, and you've said that it is your most sought after treatment. So, first of all, why do you think Botox is so popular?
Well, I think there's a good direct-to-consumer campaign from the companies to get out there and let people be aware of Botox and its uses, and of course the ease of which this aesthetic procedure can be performed. So, when patients come in, one of their biggest complaints is the line between their eyebrows or their forehead lines or the lines around their eyes. I mean, they'll immediately say, I don't like this line right here.
Right.
And of course, Botox
The
is
11, right?
yes,
The
correct.
11.
Botox is the treatment for that area, and so it becomes basically what we call the gateway to aesthetic medicine. People come in for that furrowed line, which then makes them look sad or angry or distressed. And when you actually treat that area, they look more refreshed, they look happier. And there's actually studies out that show that Botox will actually help with depression because of where these muscles are maintained in a concentrated fix. Sometimes by releasing those, the patients will feel better. That's actually a true study that's out there. So, it's the easiest aesthetic treatment to obtain in a physician's office or a med spa. And it's quick, and it usually has little to no complications with it. So that's why I really feel like it's one of the most sought after treatments. What I find is when people are coming in who have been treated in other places, a lot of times when they'll say it didn't work or it didn't work that long, you really have to watch out about how many units are being used in certain areas.
Okay.
And a lot of times patients just aren't being given enough units to actually freeze the muscle for the full 3 months to 4 months. And so although the cost may be less, what they're actually not getting is the full treatment. So knowing how many units to put into each of these muscles that will actually give you a full relaxation of the muscle for 3 to 4 months is also important when you seek out and get Botox. It's not something that most people think about or even would think about, but it's something we're very conscious of here at Living Well, making sure that we treat what we call a full correction. So our patients are usually very happy with their Botox treatments, and they do very well. And they come back over and over and over.
And they come back, you repeat customers, right?
Absolutely.
So Dr. Chapman, I'm guessing pretty much anyone that has these concerns would be a candidate for Botox. Are there any people who would not be good candidates for Botox?
So people with certain neurological diseases that create problems with the muscles, we would want to screen those patients and make sure that they're not, we wouldn't want to worsen those conditions.
Okay.
Sometimes patients with Bell's palsy, I will do the opposite side to try to even out and balance. Yeah. But that's about the gist of it. Myasthenia gravis is one that comes to mind. I would not treat a patient with myasthenia gravis with Botox. Patients with severe autoimmune disorders should not be treated with Botox. And that's in the package insert as well. But other than that, we usually can screen the patient or quick health screening to determine, but most people are able to have Botox. The great thing about Botox too is that we have years and years and years of safety data with this drug now. And it's been around for a very long time.
Yes,
I think the first treatments with Botox were back in 1997, 98.
Okay.
Although they were for medical treatments, we then developed cosmetic treatments off of those because we saw what it was doing medically and was able to then utilize it cosmetically. It boomed through the 2000s, and now we have, in 2021, it is probably the #1 aesthetic treatment that is sought after around the world. First and then second coming in are the lips now, injections in the lips. So
Gotcha. Yeah, so it's been around long enough to where we know that if there was going to be any potentially harmful effects, we would have seen them by now, right?
Absolutely.
part.
And the things that we see in the package inserts that create issues when people come in and read their consent forms, those were in studies, large doses. They weren't
Right.
at the doses we're giving for cosmetic use at this point. So,
Again, another reason though to see a professional when it comes to this, such as yourself at Living. Dr. Chapman, thanks so much. We're looking forward to our next conversation.
thank you for having me.